Hey everybody, welcome to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Montelukast with a brand name of Singulair. This medication is classified as a leukotriene receptor antagonist. Before I get into the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source of recommendations for your personal health care. So this medication is commonly seen in adults as well as pediatric patients above the age of 2 when they're dealing with prophylactic or chronic symptoms of asthma. This includes the prevention of daytime and nighttime symptoms that they're experiencing. We do sometimes see it alone, but more often it's combined with inhaled corticosteroids when treating asthma. Singulair can be an option for people who experience exercise-induced bronchoconstriction, and in people 15 years or older, it can be used for the treatment of seasonal allergies. Typically see this medication given in the tablet form as a 10 milligram tablet. However, there are chewable tablets as well. They come in at a strength of 4 milligrams and 5 milligrams. And there are also 4 milligram granules. Typically at this point in the video, I discuss contraindications to the medication. With this medication, the only contraindication would be if somebody had a hypersensitivity to any component of the medication itself. For this medication, it's more important to talk about the precautions and warnings. Patients should be informed to continue using their Montelukast or Singulair daily as directed unless otherwise directed by their physician. Sometimes people stop taking the medication when they're asymptomatic or when their asthma becomes uncontrollable. In this situation, you would just keep taking the medication, but let your physician know as soon as possible. Patients should also be clearly made aware that this medication is not to be used as a rescue medication if an asthma attack was to occur. It's important for prescribers to ensure that these patients have appropriate medications for these situations. This next point won't be important for all patients, but it should be noted that the chewable tablets do contain aspartame. While the dose of some inhaled corticosteroids can be decreased over time under medical supervision, it's important to note that Singulair should not be stopped abruptly or substituted for oral or inhaled corticosteroids. For patients who have an ASA hypersensitivity, it should be noted that occasionally this medication can cause bronchoconstriction in these individuals. The elimination of Montelukast or Singulair is prolonged in individuals who have mild to moderate hepatic insufficiency. However, even though this fact is known, it's not recommended to change the dosing for these individuals. Once somebody is made aware of all the precautions and warnings and they start taking the medication, as I mentioned at the start of the video, they'll typically be taking a dose of 10 milligrams daily. Each form of this medication can be taken with or without food. And as mentioned earlier in the video, it's just very important to continue to take this medication through those times of worsening of asthma symptoms, as well as when asthma is controlled. Now, as with all medications, there are some side effects that you may experience when you do start taking it. Some people experience fatigue with this medication. Abdominal pain and fever are seen in about 2% of people. Diarrhea, upset stomach, and sometimes some dental pain, all coming in at less than 3%. Headache would be the main side effect people seem to notice, coming in at about 19%. And dizziness and insomnia come in again at low percentages at about 2%. Some people may notice nasal congestion or a cough. Rash is seen in some people, and there can also be an increase in kidney function tests, so your AST and ALT. That's all we're going to talk about today with Montelukast or Singulair. As always, I'm thankful that you took the time to come by and watch one of my videos. If you'd like to support the channel and help see it grow, you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. Take care.